All right, welcome. Today we're going to tackle a word that, affects millions and millions of lives: cancer. Our plan is to break it down from what the problem actually is all the way to how we can prevent it. So let's jump right in. So let's start with a number: 1 million. That's roughly how many new cancer cases pop up in India every single year. And a number that massive, well, it tells you just how important it is for all of us to understand this challenge. Not with fear, but with real, solid knowledge. And that's really our goal here today. We're going to pull back the curtain on the science, take a good look at the warning signs you should know about, and then explore the really powerful tools we have for prevention and, super importantly, early detection. Okay, let's get into it. Okay, first things first. What even is cancer? It sounds so complex, almost mysterious, but when you get down to it, the basic idea is actually pretty straightforward. So think of it this way. At its heart, cancer is basically a two-part problem. First, you have cells that just start growing like crazy, totally out of control. But here's the kicker. The second part: those rogue cells also learn how to invade the healthy tissues and organs around them. It's that 1-2 punch, uncontrolled growth and invasion, that really defines what cancer is. And yeah, cancer doesn't always just stay in one place. You can think of the very first tumor, what we call the primary tumor, as its home base. But the real danger is when some of those cancer cells break off, travel somewhere else in the body, and set up a new camp. These are the secondary tumors. They're like little outposts, and they're the sign that the cancer has started to spread. All right, let's zoom out a bit and look at the bigger picture, because it gets really interesting when you start comparing cancer trends on a global scale versus what's happening in a specific place, like India. Some really surprising and honestly revealing patterns start to show up. So check this out. For women, and actually for everyone combined, breast cancer is the most common type, both around the world and in India. Pretty consistent, right? But for men, whoa, it's a totally different story. Globally, the #1 cancer for men is lung cancer, but in India, it's oral cancer. So what's going on there? What explains that huge difference? Well, a huge piece of the puzzle comes down to one thing: tobacco, but specifically how it's used. In a lot of Western countries, smoking cigarettes is the main way people use tobacco, and that's a straight line to lung cancer. But in India, chewing tobacco is much more common, and that, as you can imagine, leads directly to those higher rates of oral cancer. It's just a really clear, powerful example of how our habits and culture can directly shape our health outcomes. But here's something important to remember. Just because a cancer is the most common doesn't automatically mean it's the deadliest. The two don't always line up. In India, breast cancer is actually both. It's the most common and the leading cause of cancer deaths. But if you look at the whole world, lung cancer is what causes the most deaths. And that difference, it really highlights why we need a two-pronged attack. We need great prevention, for sure, but we also need treatments that work and that people can actually get to. So that leads us to the big question, right? What actually causes cancer? And the truth is, there's usually not just one simple answer. It's almost always a mix of different risk factors. Some of them are things we have control over, and, well, some of them we just don't. A lot of the big risk factors are tied directly to our lifestyle, the choices we make every day. We already talked about tobacco in any form. That's a huge one. Drinking alcohol is linked to cancers of the liver and rectum. And yeah, even our diet plays a part. Things like high-fat diets have been connected to breast cancer, and eating a lot of smoked foods like fish can bump up the risk for stomach cancer. And it's not just about our personal habits. The world around us, our environment, absolutely matters. Being exposed to certain chemicals on the job, stuff like benzene or arsenic, or even just too much radiation, all of that can increase your risk. And believe it or not, so can certain viruses. You've probably heard of HPV, the human papillomavirus. That's the main cause of cervical cancer. And viruses like hepatitis B and C are major risk factors for liver cancer. Okay, so knowing the risks is step one. But step 2 is just as critical: learning how to spot potential trouble as early as possible. And to help with that, there's a really simple, really powerful acronym that honestly everyone should commit to memory. It's CAUTION. Let's walk through it letter by letter. C is for a change in your bowel or bladder habits that doesn't go away. A is for a sore that just doesn't seem to heal. U is for usual bleeding or discharge. T is for a thickening or a lump you might find in your breast or really anywhere else. I stands for indigestion or having trouble swallowing that's persistent. O is for an obvious change in a wart or a mole. And finally, N is for a nagging cough or hoarseness. Now, this is super important. Spotting one of these doesn't mean you have cancer. Not at all. They're just signs. They're signals from your body that it's a good idea to go get checked out by a doctor. And that brings us to what I think is the most empowering part of this whole topic. What can we actually do about it? The battle against cancer is really fought on two main fronts. First, preventing it from ever getting a foothold. And second, finding it as early as humanly possible if it does. So let's break that down. Primary prevention, that's just a way of saying all the things you do to lower your risk to try and stop cancer before it even starts. Secondary prevention is all about early detection, using screening tests to find cancer when it's still tiny and much easier to treat. And both of these strategies are just absolutely crucial. So, what does primary prevention actually look like in real life? Well, it's all the stuff we've been talking about, right? Staying away from tobacco, cutting back on alcohol, eating a good balanced diet, and protecting yourself from hazards at work or in the environment. And one of the biggest ones? Getting vaccinated against those viruses we know can cause cancer, like hepatitis B and HPV. And just to really drive home how powerful vaccines are in this fight, get this. It's estimated that the HPV vaccine alone can prevent something like 70% of all cervical cancers. Just stop and think about that for a second. That is a massive life-saving impact, all from a simple vaccine. Now, on the other side of things, secondary prevention, screening is the name of the game. Regular pap smears to catch cervical cancer, mammograms for breast cancer, and for people at high risk, like heavy smokers, low-dose CT scans for lung cancer. These are all proven ways to catch it early. And just general awareness, like knowing how to do a breast self-exam. That's powerful too. It helps people notice changes in their own bodies and get help a lot sooner. You know, as we talk about all this science and data and statistics, it's so important to remember the human beings at the center of it all. This quote here really says it all. That beyond all the treatments and prevention, things like quality of life and compassionate care, making sure a patient is free from pain, that's not a bonus. It's a fundamental human right. Wow, we have covered a lot of ground, haven't we? From what happens inside a single cell all the way up to the choices we make every day. If there's one thing to take away from all this, it's that knowledge really is power. It's the power to take a bit more control over your own health. So I'll leave you with a final thought. With everything we've talked about, what's just one healthy choice you can make for yourself starting right now, today? Thanks so much for tuning in.